How is he? Is he like active boy, going to sports, and how is he?
Doctor, he's
Physically
doing good.
active?
Yes,
Okay.
doctor.
How is he in studies?
He's a bright student, doctor.
Okay, that's good. And he has he ever complained of any headaches
No, doctor.
or any vision problem like double vision or bloody vision?
No, doctor.
Very good. Does he ever tell you that he feels colder than other people do?
No, doctor.
Okay. And how was he from birth? He was born as a at normal age, like he was full term.
Yeah, doctor. He born at
Mhm.
normal delivery.
Okay. And he grew normally. He started crawling, walking at his usual age.
Yes, doctor. He met his all the milestones on the time. Sitting,
Excellent.
walking, talking, and
Hmm.
specifically everything as per expected ages. He
Excellent.
has
And
never
how about
been.
his?
Yeah, but doctor, he was never been big actually, but always kind of small, but okay to me according to that
Hmm.
health visitors, doctors.
Hmm. Okay, I can understand. And how about his vaccination? Is he vaccinated up to date?
Yes, doctor.
Okay. Tell me about his diet, what he likes to eat.
Doctor, most of the time we are eating from outside and we are taking home food
Mm,
also. But
okay.
uh, let me be clear that um, we eat everything, doctor.
Okay. And how about milk and eggs and protein intake? Does he take milk every
Everything,
day?
we take normal diet, doctor. Everything normal.
Good. That's good. Okay. And does he ever complain you that he has leg pains or bone pains?
No, doctor.
Okay. Mrs. Khan, I would like to ask you one thing that how about your height?
You mean to say my height?
Yeah.
Doctor, my height is I'm 155 centimeter, 5 foot and 1 inches.
Hmm. And how
And
about her father, his father's?
his father height is 5 feet and 6 inches.
Okay.
He's
And did
relatively shorter actually, and
hmm.
yeah.
Okay. And does he tell you that he achieved his puberty little bit late than his peers, his father?
Once he mentioned that he was a late bloomer actually, and didn't
Hmm.
grow up properly until 15 and 16. And
Hmm.
he was
Okay.
shortest in the boys in his class of the years.
Mm-hmm.
And
Mm-hmm.
for me also, doctor, if I remember, my puberty also was late. That's
Okay.
what I'm thinking now.
Mm-hmm. Okay. And how about him as now? Have you noticed any deepening of voice or any puberty changes in him now?
Doctor, he's achieving his everything because as you mentioned that he's
Hmm.
like say malehood kind of thing he's getting, doctor.
Very good. Okay, but only he's not attaining his height, right?
Yes,
Okay,
doctor.
so what is the most worrying thing that is bothering you? What's your utmost worry regarding his height?
I'm worried that his hormones are not working properly. Maybe something there is something
Hmm.
wrong with his growth.
Hmm. Okay. And how is it impacting him, like psychologically, and you as well as a parent?
Well, doctor, he gets comment from at the school. Most of them
Hmm.
he get the jokes, but sometimes it hurts, doctor.
I can
So yeah,
understand. Yeah.
yeah.
Mm-hmm. And in what way you want me to help you today, Mrs. Khan?
Well, doctor, we are hoping that you could tell us that is this normal or we need some other test, something to do.
Mm-hmm. Okay. Okay. So far, Mrs. Khan, you told me that you have 15 years, 14 years old son, Mr. Ahmed, who you think is not a little bit catching behind his height, and you're concerned it could be related to his hormone, and you want me to do any test that could be needed. That's all.
That's all, doctor.
Okay, Mrs. Khan, looks like from the history, as I didn't see Mr. Ahmad, that I would like to see. It looks like that he has having a short stature, constitutional gray, but I would like to first see his growth chart if it is available with me. And after that, it's a good idea to go for an X-ray of the hand. What do you think about it?
Doctor, which hand, doctor? Both hand?
Right hand? I don't remember right or left.
Okay.
Ex- Okay. Right hand or left hand?
Okay. What else, doctor?
Okay, then we'll also do some hormones for him. If I see that his X-ray is normal, then I would like to proceed with some tests like TSH and FSH, LH, and prolactin and serum testosterone.
Okay. What else, doctor?
We can also go for vitamin D,
Hmm. What else, doctor?
um, and a growth chart. Uh,
Mhm. Okay.
okay, what else could be done? Testosterone?
Oh,
No
okay. So,
idea.
doctor. Okay. So, will he be okay in this with his high, doctor?
Yes, if I see the X-ray and the X-ray shows that there is still a gap in the growth plate is not fused and the age is little bit behind, like less than 2 years gap is there between the bone age and the X-ray age,
Hmm.
usual age, then it is a constitutional as he has the it's from the family. Your height is also less. Father also had late puberty, so he has a time that he can catch up his growth spurt. Are you getting me? And if
Oh,
we
yes, I'm
find
getting,
that,
doctor.
yeah, so if the X-ray shows me anything worrisome thing, then I would refer to him to the specialist to go for other tests. Are you getting me? But I'm
Okay,
hopeful
doctor.
that after seeing the X-ray only I can decide. And the thing is that it's usual for the boys. Still he's only 14. So many boys they have a growth spurt after the age of 15 or 16. It happened with you with his father. Are you getting me?
Okay,
Okay.
doctor.
And but it is important that he
So,
should be
doctor, do you think
reassured.
this is a constitutional delay, doctor?
I think so that it is a constitutional delay. If the X-ray, after seeing the X-ray, I can surely tell you, but most probably
Hmm.
it looks like this. So it's
Okay,
important that
doctor.
I have to talk to him and reassure him, and also in his school, please check with with the class and the school nurse that he should be reassured that he's not
Hmm.
bullied and nobody is making fun of him, so that it doesn't impact him psychologically. Okay, and bring him to him. I will also reassure him. Okay, if he's
Mm-hmm.
not catching up growth in the next 2 years, and
Mm-hmm.
I will follow him every 6 months, but if he's not catching up, then we can refer to him to the specialist. Okay.
Time up. Okay, Dr. Arab. First of all, let's talk because this is one of the most commonest scenario in the exam appears, and every time come with a worried murder.
Okay.
With in a detail to discuss about the constitutional delay and familial delay,
Mm-hmm.
familial issue. But let me uh, tell that you did very well case. The X-ray must be on the left hand.
Okay, I did
Left
not know
wrist.
about this. X-ray
Doctor is
left
left
wrist.
left wrist,
Okay.
doctor. Yes, doctor.
Okay.
That's what I
If
was
I
telling
say
about
left,
serious.
then they will show me the X-ray because I didn't say left,
They
so they
might show
didn't
they
show
might
me.
show the X-ray also.
Okay. Okay.
Okay. So, first of all, associated symptom you have to ask for systemic, like say patient having fever, night sweats, recurrent illnesses, appetite.
Hmm.
Okay, you ask energy and exercise tolerance. You ask GI symptoms. You have to ask because patient might present with some sort of chronic diarrhea. Okay, celiac
That I
disease.
missed.
Okay,
Yeah, yeah, that I
constipation or
missed.
tummy pain, whatever so on. In the
Hmm.
endocrine, you can touch about that colder and hotter kind of stuff. You can ask about excessive thirst or urination or
Hmm.
um, headache. You ask about any pituitary involvement and birth and early growth. So
Hmm.
he was born at a normal delivery met milestone. Okay, but in
Hmm.
the past medical history, you see that he don't have any problem. So past medical history, surgery was not done. There was no issues actually. In the family, you see
Hmm.
that both mother and father had issues. So this is a
Hmm.
constitutional delay. Most of the time, we call it constitutional delay. Okay, and
Hmm.
why it is a constitutional delay, I'll tell you, doctor. Okay, in that one, for example, if you're going to do any blood investigation, so you can tell the patient, I would first ensure that accurate plotting of his height and weight against age and mid parental height. Okay, assess his growth, velocity, and arrange. I'm going to arrange his bone age X-ray. Okay, which will be on the left wrist.
Okay, bone
And
age
I would,
X-ray.
yes, okay, bone age X-ray will be called, we call it bone age X-ray. And I would
Mm-hmm.
like to perform some baseline investigation. I will be performing that based some baseline investigation. Doctor, what? Full blood count, CBC, CRP, urine electrolyte, LFT, thyroid function test, celiac disease, celiac screening actually, sorry. Okay.
Ah, okay, that's
Yes, celiac screen
interesting.
is mandatory in this case, doctor, and as
Okay,
important as LH and FSH. So
okay.
you have to be more focused on that one. Once you have
That this is what I was
mentioned.
missing, doctor.
Yeah, that one was missing, doctor. In that way, the
Okay.
because you didn't ask about anything about diarrhea and recurrent
Yes, yes, yes.
infections. Okay, so in
Okay.
the history part,
Mm-hmm.
that was missing, and
Mm-hmm.
you can say that likely the diagnosis of suggested as by the history, as you mentioned, this is because long-standing short stature of your child with normal weight and systemic health, good systemic health, delayed
Mm-hmm.
puberty, but otherwise he's well. Okay, strong family
Mm.
history of late puberty and short parents. Okay, I'm
Okay.
suspecting
Okay.
that it is he is suffering from the constitutional delay of growth and puberty.
Okay. Okay. I
Okay,
got it.
plus
Mm.
doctor here that what you are going to do as a differential to exclude by history examination and investigation. Okay, familial
Mm-hmm.
short stature without delayed bones age. Okay, differential. Endocrine likes a
Mm.
hypothyroid patient, child growth hormone deficiency, and hypogonadism.
Mm.
Okay. And
Mm-hmm.
chronic disease like say celiac, IBD, renal disease, cardiac disease. Nutritional deficiency like say patient, a child who is not eating well or some other issues are there. And genetic syndrome like say Turner's in the girls, for example.
Mm-hmm. Mm-hmm.
Um, you have to explain and reassure in a way that from what I have seen so far, Ahmad is generally healthy but smaller and later in the puberty than many of his classmates. Are you getting me, Mrs.
Mm-hmm.
Khan?
Mm-hmm.
Okay, this is often runs in the family and this is called constitutional delay of growth and puberty.
Okay.
Take pause and take, it is usually take pause and say that it is usually means that he will grow and go through puberty later than the average, but still reach
Mm-hmm.
to height close to what we could expect based on you and your husband's height. Okay, now here,
Mm.
now you're not going to give any false hope, huh? You're going to
Okay.
mention that, okay, it is based on your height and your husband's height. But we will still do some tests to rule out any underlying medical problem. But at the moment, there is no red flag suggesting something serious.
Okay.
Okay. Yes, and you
Mm-hmm.
can see that there is a wide range of normal for the puberty. Some boys start early, others start
Mm.
much later. Being
Mm-hmm.
led can be very difficult emotionally, especially at school. I can understand as Mr. Master Ahmed is passing through, but it is
Mm.
often still normal. Are you getting me,
Okay.
Mrs. Khan? Okay, now
Mm.
you are going to address patients, the bullying and self-esteem. I'm sorry to hear
Mm.
that other boys make comments on your child. It's really hard for you being a parent, and for Master Ahmed also, it's very difficult. I can understand. We can talk to the school if you would like to make sure they
Okay.
are aware and can support him.
They
Okay,
are aware.
encourage,
Okay.
yes, okay, and encourage the involvement in the strengths and interest not related to height, academics and hobbies and music. You have to grow your child in other fields to
Mm.
get him prominent rather than thinking about heights. Are you getting Mr. Getting Mrs. Khan? Okay,
Mm.
so
Mm-hmm.
so what we can suggest that we will be looking for the activities where height is less relevant. Are you getting Mrs. Khan? Okay,
Mm.
now
Okay.
you're
I
going to
understand.
involving the school and support system. Okay, in that way you can
Mm.
say that we with this I'm going to write down one letter to the school explaining there is a medical evaluation ongoing, that he's healthy and highlighting the need to watch for his bullying. Okay,
Okay.
and I'm going to
Okay.
suggest pastoral support in Pakistan and India. I don't think there is a pastoral support is there, but you can say that a school committee will be looking after this one. Okay, school
Mm.
committee or a school counselor. As per the Pakistan, there is no
Okay.
pastoral services, but in Gulf countries and other countries we have pastoral services.
Mm.
And now the most important part to calm down the mother. Mrs. Khan, it is
Hmm.
understandable to feel upset and frustrated seeing others goes faster. This doesn't mean that you are less of a person or that you will always be behind, your child will always be behind something. You have to encourage, okay? Parents to
Hmm.
be
Hmm.
mindful and not to make the jokes about height, okay?
Okay.
Offering sign posting to the youth counseling or mental health support if parents want to show if like the parents say that his son is showing up low mood and social withdrawal and self-esteem issues.
Mm-hmm.
Okay, you can talk about medical things, but examiner want to listen from you these things. Okay.
Hmm. Mm-hmm. Okay. So if the child is psychologically depressed, so it's possible that I can say that if you feel that your child start to have low mood and he is avoiding contacts, please bring to me. We can get help for the mind doctor, and we can also go for talk therapy. We can say this way.
Yes. Yeah.
Okay. Okay. Thank you, doctor.
Welcome, doctor. Dr. Jaya. So
Yes, sir.
you are the next doctor. Give me one sec, doctor. Dr. Saima said, there is no such thing to explain. Okay, we will say that we will be looking at the bone scare, his bone age X-ray, and as per the bone age X-ray, then we will be deciding. Okay, from the history, because from here, examiner want to listen from you how you're getting from the history. This is a constitutional delay or familiar or whatever so on. Huh? Okay, doctor. Give me one second, doctor. Okay, Jaya, your patient, yeah, the mother of a 3 years old boy, come to discuss her child with problem with you and take proper history and manage the patient. Examination is not required.
Okay.
Okay, give me one second, doctor.
Yes.
Okay, start.
Good morning. I'm Dr. Jaya. May I know your name, please?
Uh, Doctor, I am Mrs. Tania.
Mrs. Tania, right?
Yeah.
Okay, Miss Tania, how may I help you?
Doctor, I'm worried about my child, Master Yusuf, his weight actually. He's hardly eating anything. He's so fussy, doctor. I feel that he's not growing properly.
Okay, Mrs. Tania, before proceeding, may I know where is Yusuf right now?
Doctor, he's in nursery.
Okay, Mrs. Tania, it would be better if you just bring him next time so I can just see him, okay?
Sure, doctor.
Okay, Mrs. Tania, please can you tell me more about Yusuf's condition?
Doctor, he looks skinny and compared to other children at the age, and health visitors say that his weight is less, has dropped on the chart, and as compared to his last check, doctor.
Okay, Mrs. Tanya, I can completely understand you sound very distressing being a mother. We are here to help you, but I need to ask you a few more questions. Is that okay?
Mhm.
Okay, Mrs. Tanya, do you know his recent weight?
Doctor, his recent weight you're talking about, that what you call it, the health visitor told me that
Yes.
he is not properly growing. She didn't mention anything about the weight.
Okay, did you bring his growth chart that the visitor marked?
No, doctor, I didn't bought. Next time I will bring, but I wanted to know something about from you.
Okay, I am here to help you. Okay, Mrs. Tanya, can you please describe Yusuf's daily diet with me?
Doctor, let me tell you a little bit more. He's a typically sometime in the breakfast he take bites of toast or small yogurt. Often he refuses, doctor. For the lunch I'm preparing, doctor, just nibbles or the bread or few chips. Sometimes some cheese, doctor.
Hmm.
For the snacks, he prefers, doctor, snacks like crisps and biscuits or crackers. And
Mm-hmm.
I think if I let him, he would live just on these things only, doctor. For the dinner, usually he eat plain pasta or rice, maybe a bit of chicken if we are lucky, doctor.
Hmm.
He
Okay.
drinks a lot of milk, doctor. Sometimes 600 to 800 ml per day, doctor.
Okay. Would you like to add anything else?
Well, doctor, fruit he don't eat, vegetables he don't eat. That's it,
Okay.
doctor.
Okay. Okay. Thank you for responding, Mrs. Tanya. Mrs. Tanya, I would like to know, does Yusuf complains of any tummy pain?
Well, doctor, no, but occasionally he gags actually when we are going to try it. We are trying to give him new food.
Okay. Okay. And Mrs. Tanya, any what about his bowel motions?
Uh, he opens his bowl once a day, and or maybe some other every other day. Soft stool, doctor.
Okay. Any vomiting?
Occasionally, I told doctor is gagging actually.
Okay. No vomiting, right?
Yeah.
Okay. Any fever recently?
No, doctor.
Okay. Mrs. Tanya, are his stool very smelly?
No, doctor.
Okay. And does he feel cold, uh, like more than the other feels?
No, doctor.
Okay. Any back-to-back chest infections? Have you
No,
noticed?
doctor.
No.
No,
Okay.
doctor.
Okay. Mrs. Tanya, would you like to describe your mealtime at your home? You all.
Doctor, we are eating home because since I'm working, my husband is also working. So just I give the food to my child and go to the work. And after that, my nanny is taking care of my child.
Okay. And whom do you live with at home? Like how many members?
Doctor, me, my husband, and my nanny.
Mm. Okay. And you also work and your husband also work. So financially, there's no problem, right?
Yeah, yes, doctor. We are running for bread and butter, doctor.
Okay. Okay. I understand. Okay, Miss Tanya, any past long-standing medical illness on for Yusuf?
No, doctor.
No. Okay. Any past long illness in family?
No, doctor.
Anyone in the family smokes?
No, doctor.
No. Okay. And does anyone drink alcohol?
No, doctor.
Any recent behavioral change that you noticed in Yusuf?
No, doctor. He's just picky eater. He don't like to eat actually. That's it only.
Okay. How's his relationship with his father and nanny?
Hardly we are getting time to interact with him, doctor.
Okay. Okay, we'll talk about this. And okay, so Mrs. Tanya, what's crossing your mind? What this Yusuf has?
Well, doctor, I think he's just a really picky eater, but I'm worried that he's gone beyond the normal fussiness.
Okay. Okay. And Mrs. Tanya, other than his weight and his skin, is any particular concerns?
And look, see, it's no.
Doctor, I'm scared that he will not grow up properly, and maybe he might get some sort of serious unless serious something inside.
Yeah, I hope not, but we'll talk. And any particular expectations from me today?
I'm hoping that you could do something for him. Give me some medical reason. Give me some medication.
Okay. Okay, Miss Tanya, from what you told me, I suspect that the reason of his not gaining the weight is his eating habits. Okay.
Hmm. Hmm.
So the risk factors which I found are many. So we'll talk one by one. Okay. First of all, I will talk about some strategies so you can improve so that Yusuf can eat better. First of all, just involve him when you do some groceries, right? Just ask him whatever he needs. And whenever you are preparing the meal, okay, just get him by your side and, just involve him in meal preparing. Can you do that?
Okay, doctor.
Okay, just keep introducing new foods to him. Okay, and just make a proper meal time at your home. I understand you must be very busy and you are on a there are some financial constraints, you're working, but still for the betterment of your child, I will recommend that your husband, and just sit on one table, make Yusuf sit on that table without any restrictions, no TV. Just make him eat food with you, so he will notice and he'll start eating. Do you understand?
Mm-hmm. Mm-hmm.
Okay. Second is his too much milk intake. This also contributes towards his less eating. Okay. So
Mm-hmm.
I would recommend this, you cut down on his milk. Okay. And instead add proteins and fruits in his diet. Like you can make different colorful dishes appealing to the child. Okay. Different fruits with colors, and you can make mealtime a fun way to interact with you as well. Okay,
Mm-hmm. Mm-hmm.
can you do that?
Okay, doctor.
Okay, next time when you will bring Yusuf, I will check him. I will look if there is currently, according to what you told, there nothing seems to be dangerous. But I would like to see him once. Okay, I will note down his weight as well. Okay, for now, you just try these things. Okay, and if you want some financial supports on Yusuf's nutritional needs, I can just attach you to some social services if you are okay.
Mm-hmm.
Okay, and just keep eating, just don't worry about the mess he makes. Okay, just child will learn like that. Okay, and I will monitor him frequently, like every 3 monthly. Okay, so we will have a check on his weight. If his weight is declining even after following these strategies, okay, then we might
Mm-hmm.
refer him to some specialist or might do some tests. Right now, there is no need. Okay, and you follow these strategies for like 3 months and do let me know that how is Yusuf progressing.
Mm-hmm.
Okay, is there anything else, Miss Tanya, you want to ask?
Doctor, I'm guilty, doctor. I'm not a good mother.
No, Mrs. Tanya, don't be guilty. You are working for Yusuf, okay, and you are working for his betterment, okay, and they're just small gaps that you are taking in your work. If you just try to spend time with Yusuf, that he will do much better than your expectations.
Okay, doctor.
Okay, it's totally not your fault. Be reassured, and just try to take breaks and try spending time with Yusuf. Okay,
Mm-hmm.
I will see you after 3 months, and please bring Yusuf next time. Okay,
Okay, doctor.
thank you.
Time up. Dr.
Yes, sir.
Jaya.
Yes, sir.
Impact always important in pediatric and proxy cases. Okay, impact is mandatory for everywhere.
Yes.
Eyes impact is more important. Okay, please make sure that you should not forget
Hmm.
impact, concerns, ideas, and expectations. Okay, so there from there
Yes.
you will be getting the idea. Okay,
Hmm.
this
Hmm.
patient need explanation and reassurance. You have to acknowledge the problem of mother's effort first of all. You have to say that you clearly putting a lot of putting in a lot of effort, and meantime sounds very stressful for you. I can understand. I can see Master Yusuf is on the small side of weight, and he dropped down the centile chart. Okay, but which we take seriously. But his height and development are reassuring, though, Mrs. Tania, and we have to reframe in a way that the pattern and his
Hmm.
examination suggest, for example, and that done by that health worker, that is most likely related to how and what he is eating rather than a serious underlying disease. Okay, although we will do some basic blood investigation to check next time. So, for being, shall we discuss something different? Here we call it, Mrs. Tania, we call it feeding and behavioral strategies. Okay,
Hmm.
these are the central, okay. So structured and meal and snack routine. For example, offer 3 time meals, and 2 to 3 planned snacks. No gazing, no grazing constantly throughout the day. Okay. Limit milk as you suggested and sugary drink. Mealtime rules. Okay, mealtime rules like say sit in the table with the family as much as possible. No screen, no toys or distraction during the meals. Offer small portions of the family meal, including the least one food he usually accept. Okay, this is the main thing to
Sir,
talk
can you
about.
repeat, please?
Okay, you have to offer small portions of family meals. Okay,
Okay.
including the least one food he usually accept. For example, he don't like one food, but don't offer him in a bulk. You offer him, for example, there is a website, doctor, makemyplate.org, by USA website is there. This is one of the best website for the pediatrics they are using to encourage the family members to how to teach the parents. Okay, so in that way, it is written over there. I was reading other day. If like say your child is not eating well, so you have to make sure that you have to uh, 75 and 25%. Okay, so you have to keep his favorite 75% food with him and 25% that he new food introduction or least accepted food. Okay, so you have to do like this and allow 20 to 30 minutes for the meals. After that, remove the plate calmly, no prolonged bargaining.
Yeah, don't force.
Okay. Yes. Avoid pressure, bribes, and battles. Okay. Do
Mhm.
not force, feed, or chase him with the food. Praise any positive attempts, even small test, and rather than criticizing refusal. Okay, if he's taking small bite, also fair enough. You have to use neutral responses to refusal, like say, okay, maybe next time. Okay, we can do it for next time, no problem. We will take next time, no problem. And remove the drama from eating. Okay, exposure to the new food. Okay, encourage food play and repeated low pressure exposure. Okay, like say food play, you can some sort of thing you can play around. So you can explain in a way, doctor. These are the common things I'm telling. So one or two things if you're mentioning over their exam, so it's fair enough. Okay, it can take many exposures before a child accept new food. Okay, so don't worry, Mrs. Tania. Now you can phrase Dr. Jaya like this. Our aim to make meal time calm and predictable. Reduce how much he fills up on milk and snacks. He gradually increases intake by. Okay, by gentle encouragement without turning every meal into battle. Okay, like say shouting, yelling on the child, it is not recommended. Okay, and nutritional support, referral for pediatric if like say patient having weight is below second percentile or dropping, diet is very restricted, child is not eating anything at all. Yes, you can refer this patient to the pediatric dietitian or pediatrician. Okay, in our Pakistan we can refer to pediatrician. Apart from that, doctor, so doctor, there was one more thing I wanted to remember. In a way, nutritional support, address. Yes, family anxiety. Okay, many parents in your situation feel guilty or worried that they are doing something wrong. I can assure you, it is nothing such thing is wrong. You are putting a lot of effort into it. Okay, so you have to calm down the parents and do go with the safety netting and come back.
Okay.
Okay, Doctor Sarvat is there.
Yes, I'm here, sir.
Okay. Dr. Sarvaz, your case is there. So your patient is mother of 7 years old Omar. Come to discuss her child problem with you and manage the patient, examination not required. Counsel her and examination not required.
Okay, sir.
Okay. Okay. Start, Dr. Sarvaz.
Okay. Hello, I'm Dr. Sarvat here, one of the GP. May I confirm your name and age, please?
Dr. Mrs. Kiran. I'm 42 years.
Sorry, name
I am
बताएंगे?
for Mrs. Kiran.
Mrs. Kiran. Okay. Okay, Mrs. Kiran. How can I help you today?
Doctor, I'm really worried about Omar. He keeps getting constipated lately. He has been soiling his pants.
Okay, I'm really sorry to hear about your son problem. Omar is 7-year-old, right?
Yes, doctor.
Okay, he has constipation. Since how long he has constipation?
Doctor, for the last 1 year, maybe more than that, when he has had a trouble in opening his bowels. He goes every few days, and it's often painful, doctor. Over the last
Okay,
few months, he has started having little bites of poo, like little bits of poo in his pants and during the day also, doctor.
okay, Mrs. Kiran. I would like to ask some question. Is it okay with you?
Sure, doctor.
Why you didn't bring Omar with you today?
Doctor, he's in school.
Okay, so he is in grade 1,
Yeah, doctor, he's in grade two.
grade 2 student. Okay. How often he is going to the toilet per week for stool passing?
Uh, Doctor, sometimes he does not go for 3 to 4 days, and then he really does a big and hard poo, doctor.
Okay, then he is spending more time in toilet and more straining and painful defecation, right?
Yes, doctor.
Okay. How is his water intake?
Doctor, he's taking less water.
He's taking less water. Okay. And beside this, he has any other problem?
Like what, doctor?
Any other problem like abdominal pain?
No, doctor. He often say that his tummy hurts, especially when he has not been going for the toilet for a few days.
Okay. Yeah. Then he has any like nausea or vomiting?
No, doctor.
No? Okay. And Mrs. Kiran, do you have how many kids do you have?
Doctor, I have 2 kids only.
2 kids. And youngest is the Umar?
Yeah.
Okay. Did you notice any blood in his stool?
Occasionally, a little bit bright red blood on the toilet paper after hard stool, doctor. But is there no lot? Not every time, doctor.
Okay.
And
Mhm. Any abdominal distension?
you mean to say that tummy, big tummy?
Yes.
No, doctor.
Okay. Is he physically active child?
Yes, doctor. He is active child.
Okay. Any weight loss?
No, doctor.
Any urinary urine problem, pain while passing urine?
No, doctor.
Okay. And how he was delivered? Normal delivery or by surgery?
Normal delivery, doctor.
And how is his vaccination is up to date?
Yes, doctor.
Okay. And what about development? He was sitting when he was 6 month old, sitting without support,
Yes, doctor.
and walking by 1 year without support.
Yes, doctor.
Um, uh, any allergy, drug allergy, I mean?
No, doctor.
No. Okay. Any other illness? No.
No, doctor. No, doctor.
Family history of any other disease, any significant disease runs in family?
No, doctor.
He was breastfeed baby?
Yes, doctor.
Okay. And Mrs. Kiran, some personal question for you. You said that you have 2 children. Okay. And now 42-year-old age. Okay. And what do you do for living?
Doctor, I'm a housewife.
Okay. Do you smoke?
No, doctor.
Any alcohol intake?
No, doctor.
So, what do you think? What's going on with Umar?
Uh, well, doctor, I think he is constipated. Maybe he is holding in it. But I don't understand why he's leaking, doctor.
Okay, okay, Mrs. Kiran, do you have any other particular worries?
No, doctor.
Okay, and how this condition affects your and Umar life?
Doctor, it is really worrisome for me because he did last time in the school. So it is really embarrassing for him.
Yes, I understand your problem. Yes. Mrs. Kiran, what do you want from me in this consultation?
Doctor, tell me what to do.
Okay. Okay, Mrs. Kiran, first of all, you must bring Umar to me. I want to do some examination. Okay. And some uh, talk to Umar. Okay. And I offered you some investigation like thyroid function test, um, TTG, IgA, and CBC, and X-ray abdomen.
Okay, doctor.
Okay. Okay. Meanwhile, I'm suggest you some medicine, like advices, like you should give Umar a high fiber intake diet, and give some water frequently. Give water, and I think so. Maybe he has a problem because of school, because most of the children don't like school toilet, and he is holding the stool, so that's
Hmm.
why he's developing this problem. Actually, this constipation is common in this age group while they are starting school new. So because of this toilet problem, they are not they are holding, and so stool stays longer in the gut, so water is absorbed, stool becomes harder and larger, and when it uh, child is passing stool, he is feeling more painful, and sometimes blood is coming also. So
Okay, doctor.
drug is there. I will suggest drug for you, but I want to do examination first for Umar. I want to see the lab result also, and this X-ray abdomen also. So
Okay,
can you
doctor.
bring Umar tomorrow?
Okay, doctor.
And um, just give toilet training, wake him early in the morning, so it will take time to develop this toilet training in the morning. When he will be
Okay.
free in the morning, so he will feel good at school as well. So it will take time to maintain this habit. And uh, also, don't give like too much milk, and give water, and also,
Mhm.
what else? Uh, change his routine, and medicine is there, but I want to see first Umar. I want to check.
Okay, doc.
Okay, then I will
Okay,
give
doctor.
medicine. There is movie call. We can give loading dose first, but if fecal infection is there, I will check first. I will do examination. If infection is there, then I will give loading dose, and then maintenance dose I will start. Okay,
Hmm.
it takes time. It is not a treatment for few weeks. It takes months. Then uh, then his habit of stool passing will be maintained. Then we will taper off this medicine. Are you
Okay,
getting my
doctor.
point, Mrs. Kiran?
I got it, doctor.
Okay, so don't punish her. Okay, don't punish him, don't blame him, and take a good talkative atmosphere with your son. Involve your husband also, and
Hmm.
uh, and I will be wait for you with this lab result, and also bring vaccination card and growth chart card if you have. So bring on the next visit. Anything you want to ask? You
No,
said
doctor,
one
that.
concern is swelling. When there is impaction, there is swelling. So here you will feel, but give some, um, uh, give some,
Time
sorry,
up.
yeah.
Okay, Dr. Sarwat, I have found a few things in your today's case. Don't use a double barrel questions. Okay, ask first, then go to the next. Okay, and don't do the repetition. Okay, because this
Okay.
is wasting your time. Okay, so examiner will be giving you negative marking, and same time you will be losing your time. So in the
Okay.
explained way, you have to tell the patient, Mrs. Kiran, that constipation means there is a big hard lump of the poo stuck in his bowel. Softer
Mhm.
poo from the higher up can leak around this and into the pants, which is why you are seeing swelling. Okay,
Okay.
this is not him being naughty. In this way, that Dr. Sarvat, you have to ask the patient first that when you started toilet training.
Okay. Yes, sir.
Okay, when you did a toilet training, okay. So toilet training is he have done his toilet training at the age of three, and since last 1 year, what was the reason why he gone through? Maybe school pressure, maybe bully is there, maybe some stress is there, maybe something abuse is there. So many things, doctor. We have to take care about it. Okay, so we have to express.
Okay, sir.
Okay. Yes. Okay. So sometime it might be because of the mealtime stress, sometimes school bus stress, sometimes the teacher says he's okay in academically, but he hate to because his problem was he hate using the school toilet because these are the dirty and other boys will laugh at him. So that's the reason he is holding on. That's the reason
Okay.
he is developing the constipation because
Yes.
his this case agenda was hidden in the social history.
Okay.
Okay, yes, you have to ask. Okay, do you think that? What do you think, Mrs. Kiran, that what your child is thinking about? Doctor, maybe I don't know something like this. You have to talk about the parent, the child. Then it will be easy for you to understand what he is going through. Huh? But if, like, say, you're not asking social history, definitely you will miss the board. So just you will be being, even though you are giving very good explanation, but your examiner will think that you are a judgmental because you didn't ask about the main thing. Okay. Now in the OSCE exam, some sort of things we have to talk about the management plan, like to explain to the problem in a simple term first. Second thing is the medical treatment, disinfection, then maintenance. Okay, we
Yes,
can say
sir.
that we can. It's yes, doctor.
Yeah, baby is not here. Child is not here. Without examination, we can give treatment.
We can offer that. I might offer him.
Okay. So, okay,
Okay,
sir.
we might offer him. Okay, so you are that you will be in a way that you are going to explain the parents that what will be next. So examiner want to know that whether what you know about this thing. Okay. So you have to tell that one because it is painful. It has been painful. He has started to hold in. Okay, which make him problem, which make that problem worse. Okay. The good news is that with a proper plan and time, we can usually fix this. Are you getting me, Mrs. Kiran? Okay. You best
Okay, sir.
your word was best that you avoid blaming or shaming. That is important thing. Emphasize that swallowing is involuntary. Okay. And now disinfection phase. First, we will be talking about this is Kiran. We have two phases are there in the medical treatment. We call it disinfection and followed by the maintenance phase. So shall we discuss on that one? Okay. So you have to use a normal osmotic laxative, like say we might offer some macrogol preparations are there in escalating dose to clear up the bowel. Okay, we are going to warn that one. Stool may become more frequent and initially more swelling may occur as the heart a lump breaks up. This is expected and temporary. Okay. Then we start about the maintenance. Continue. We will be continuing this one maintenance dose for the several months. Okay. Aim for daily. Aim for daily or every other day soft stool. Okay. Then we will not
Okay.
stop too early. Okay, explain that bowel
Mm.
has been stretched and needs time to return to normal size and sensation. Are you getting me, Mrs. Kiran? So that treatment takes some months to get it. Okay, sometime we have to add stimulant laxative, like say that based on your local guidelines, you can follow that one. And behavioral and tailoring, strategies, what you call it, regular toilet sitting, sit on the toilet 5 to 10 minutes after the meal, like say gastrocolic reflex, we call it, 2 to 3 times per day. Use a footstool so knees are bent and supported. Encourage relaxed posture and taking time. Then, most important again, reward system. Use a star chart or stickers for the sitting in the toilet as agreed. Trying to poo, not for actual poo output.
ओके सर.
Okay.
सर इस पे लैब्स कौन सी करवाएंगे जो मैंने बोली वही?
लैब्स उसमें करवाएंगे सीबीसी सीआरपी और नो सर नॉट सीबीसी सीआरपी ओनली विल बी डूइंग what you call it this
Thyroid profile, calcium.
thyroid profile, calcium, yes, you can go for a calcium, this kind of thing you can do it.
मीन्स
Okay,
यूरिया लगता है.
now school involvement, avoid school involvement with the consent. We are going to involve them in school. Okay, he has a medical problem, so ensure he is allowed to use the toilet when he needs to. Okay, and has access to separate spare cloths discreetly. Okay, so in Gulf countries we have this protocol that they're asking for extra cloths from the child for the child. Okay, and encourages ever to encourage the avoidance of holding on at the school if possible. Diet and fluid you mentioned very well, so I'm not adding anything. And address psychological aspect, okay, psychosocial aspect. So reassure if like say you reassure the mother that your child, this is a common problem, and he is not the only one. Okay. The accidents are not for these are accidents, not the for not the fault of your child. Okay. Reassure the parents if like say the parents say that my child is not listening to me, so we can say that way. Accidents are these are the accident, not your fault, not child fault, and reassure the parents. And we have to offer leaflets. Okay. Best way to counsel that you have to tell this is a leaflet.
Okay, yes.
Okay, Dr. Yunus.
Sir, one more thing. X-ray we will
Yeah.
advise?
No, doctor.
No, no need?
No.
Yes, sir.
Okay.
Dr. Yunus, get ready for the case.
Okay, sir.
Okay, Dr. Yunus, your patient, give me 1 second. Doctor. Okay, Dr. Anjum, in the previous case, full blood count, thyroid profile, calcium, and vitamin D. These are the mandatory. If you want to add something, you can add. Okay, Dr. Yunus, your patient is a mother of 7 years old child. Come to discuss his child problem with you. Take proper history and manage the patient. Examination is not required.
Hello, I'm Dr. Yunus.
Doctor, give me 1 minute,
Miss,
doctor. Yeah, start now.
name Mrs. Anjam.
You have to ask the patient mother name. Okay, so mother name. It is agenda of the case to how you're interacting with the that proxy.
Uh, Hello,
Yes,
I'm
start.
Dr. Yunus. Can I know your name?
Doctor, I'm Mrs. Khan.
Okay, Mrs. Han. How can I help you today?
Doctor, I'm just worried about my child Adam. He's still bedwetting at night, and we are getting really worried about it.
Okay, where is Adam?
Dr. Adam is in school.
Okay, and may I ask why he did not come with you?
Doctor, he's in school, so I thought maybe I will come and I'll discuss with you first, and after that, if it is needed, then I'll bring him.
Okay, it's better you bring next time so that I may examine Mr. Adam.
Okay, doctor.
Okay, okay. Please tell me more about Adam problem.
Doctor, he has never been dry for more than a week or two, and he's now 7 years, and he still wets most of the time, and he wets the bed about 5 or 6 nights a week, doctor. Sometimes it is just like say bit damp, other times whole bed is soaked, doctor.
Okay, so Anjam, in order to reach the diagnosis of Mr. Adam, uh, can I ask a few questions if you don't mind?
Sure, doctor.
You tell me he has never been tried since birth. Am I right?
Yes, doctor.
Okay. Please tell me about Adam. About his birth. It was.
Sorry, doctor. I'm not getting your what you want to say.
I'm saying that Adam was full term.
Yes, doctor.
Any complication during delivery?
No, doctor.
Okay. And what about his vaccination?
Vaccination up to date, doctor.
And what about his nutritional? It's good.
Yes, doctor.
And he developed everything good,
Yes,
speaking,
doctor.
everything. And
Yes,
what
doctor.
about his school performance?
Doctor, he's a bright student.
And how is his performance in school?
Good, doctor.
It's nice, very nice. And is he any fever?
No, doctor.
Any daytime passing urine or only at night time?
Only nighttime, doctor.
Okay, may I ask you some personal question?
Sure, doctor.
What about your LMP?
Doctor, my LMP is 3 weeks ago.
Okay, and how many kids you have?
Doctor, he's the only child.
Okay, and also if there is any, uh, I mean to say, incontinence of any stool also.
No, doctor.
Okay, when he passes urine, are you angry with him and punished him?
No, doctor.
Is he? Did you train your Adam about the toilet?
Yes, doctor, at the age of 3.
And what about his dietary habits? Is he taking many sugary things or daytime any more fluids at night?
Doctor, this is his problem, doctor. He don't eat from home.
Okay, is he any mm, burning in urine while passing urine or crying with
No,
urine?
no, doctor.
Okay, and did you inform the school nurse about his condition?
Doctor, I informed, but the thing, he's not passing anything at school, doctor. So what I had to inform, doctor.
Okay, is anyone in your this Adam sisters or brothers same problem?
No, doctor.
Any history of sugar in his family?
No, doctor.
Where is his father?
Doctor, he's at work.
Okay, and are you doing smoking at home?
No, doctor.
May I ask your job, what kind of job you are doing?
Housewife.
Okay. So, Mr. Ranjan, what is crossing in your mind that Adam has?
Doctor, I think he's suffering from some serious
Hello?
problem. Doctor, I think he's suffering from serious problem.
Hello?
Hello? Yes, doctor. Hello? Yes, Dr.
What's
Yunus.
crossing in your mind
Doctor,
that
I think he's suffering from some serious problem, doctor.
I hope not so. And what worries you the most?
Doctor, I'm worried that he's growing up and if he's keep on doing this thing, that it will be a problem for him.
Okay, all right. And how this condition affect your life and Adam's life?
Doctor, I'm a bit worried about him, doctor. I can't sleep because I have to wake up overnight and they have to see. But he's passing the urine. I don't know what time he passed the urine, mostly at the morning time.
So let me recap for you, Mr. Adam. This Adam has a problem of urinating, and you are worried that maybe some serious problem, and you came here for some solution. Is that okay?
Yes, doctor.
So, Mr. Anjam, Adam has a problem called nocturnal enuresis. It is the a condition when the bladder is full and bladder is passing signal to the brain, but brain is unaware of waking, so he passes out the urine, and this is not his fault. Let me assure you that this is very manageable condition. Okay,
Okay, doctor.
so we can do some share management plan together. First of all, I will advise that it will be better uh, that avoid any tell Adam to avoid any fluids at night time and sugary things like that. Okay,
Okay, doctor.
and before going to bed, must take him to bathroom and please train him in the toilet training. That toilet should be there should be light and should be unhurried. Okay,
Okay.
and also not to punish him or be angry with him because the stress is the major factor here. It will aggravate the Adam's condition. Okay.
Okay, doctor.
Rather, I will advise him to reward him if there is any dry night. So put him
Mm,
stars like that. Okay.
mm,
So there is some option with us. This is called alarm technique.
mm.
Alarm technique is that alarm is put inside the nippies, and when there is some uh, enuresis, it will ring down. Okay, are you like this or some drugs? We have some drugs also for this.
Doctor, we want to try something other than drug.
Other than drug is this behavior and training where avoid any uh, more juices at night time, and also this alarm is better, but it will take 3 to 6 months. Okay,
Okay.
but if you want urgently, there is some drug called isopressine, and it is 0.2 milligram at night given, but condition is for short time and avoid anything to give 2 hours before and after it.
Time up.
Thank you.
Dr. Yunus, let's look at your history first and history onset and primary version. You have to ask about what time he passed the urine. Most of the time, your child will be passing early in the morning, many time, majority of the children, okay? Because mostly nighttime, parents they give they take him there to the toilet and they pass the urine, okay? But the bedwetting mostly happens after 3 a.m. Okay, so second thing, daytime bedwetting. He don't have any daytime bedwetting, so there is no red flag. Fluid intake. He drinks water and juices all the day, and he drinks. He has a big drink of milk and juices with the dinner also. So we have to stop that one. Toilet routine. He has been toileted. He had a toilet training since 3 years, and he goes to the toilet before the bed, but sometimes he forget. Okay, bowel history. He don't have constipation. Sleep was. He's a very deep sleeper. Okay, so one. Number two, previous attempts to manage. You have to ask about. He that we stopped the drink for after 7 p.m. for a bit. We take him to the toilet before the bed. We tried a revived child, but if he had a dry night, but that didn't really work because he hardly ever had a dry night. Sometimes we get cross, which I know it is not good, but it is exhausting. Okay, so means like say he get angry on that child. Okay, so but in this scenario it was not there. Uh, Plus our mother is thinking about some investigation. So investigation you go have to do it only urine test to rule out
Sugar,
any urine sugar and urine routine to know about
ultrasound.
any bacteria going on, whatever so on. Yes,
Yes,
doctor.
I miss investigation.
Okay, Dr. Gulam Nabi.
Am I pass in this case?
So doctor. Yesterday was
Thank you.
yesterday was the best case, doctor. I have
Hmm.
seen. I think you have command on that case.
Thank you, sir. Thank you.
Yeah, Dr. Gulam
Excuse
Nabi,
me, Dr. Imran.
your yes,
Can
doctor.
I ask you something?
Yes, doctor.
Dr. Imran, as per AKT exam preparation, the reward system first we should give reward the child on attending the toilet regularly
Hmm.
at
Yeah.
bedtime.
Hmm.
Is this true? Am I correct?
Attending the toilet and not passing not passing that urine at the bed most of the whole week. So there are two patterns are there, doctor. So for example, if he
Yeah,
is
but
going to the toilet
they
happily and yeah, sorry, doc, yeah, continue, please.
like in the start we can give reward to the child on attending the toilet regularly, as in the history the mother also mentioned that sometime he forgets to attend the toilet,
Yeah, yeah, he forget to attend
and
the
then we
toilet
can
means
go for
then we have to go for next step,
yeah,
huh?
yeah, and then
Okay.
we can go for the next step, that on dry night. That is the point
Uh,
which
yes,
came in my
doctor.
mind.
And yes, for example, if in this case, like say constipation also with there also, then we have to think about some other ways. So we have to treat the constipation also. Sometimes case come as a constipated child also. In this patient,
Okay.
fluid and tailoring advice first line for all. Okay, for all cases. Okay, you have to educate fluid during the day, mostly water. Reduce drinks in the last 1 to 2 hours before the bed, especially milk, juice, fizzy drinks. Okay, make sure he pees just before the bed every night. Avoid caffeinated or fizzy drink in the evening. Discourage only overly strict fluid restriction all the day. Means like the mother say, I'm not going to give my child whole day fluid. Okay, so child might be dehydrated. Okay, so this kind of agenda you might get in the case. Lifting when half asleep as the main long-term term strategy, as it does not teach him to respond bladder signals. Okay, you got my point, doctor. Your child is half slept, and you're telling him, okay, Umar, wake up and let's go to the toilet. So it is not going to make it. We have to discourage this thing. This is the star comment on fluid and toileting advice. Okay. Behavioral studies already we have to
Okay.
involve Adam I'm going to involve the other once he will come. Then we will discuss with him. Of course, as per that, we have to avoid humiliation if he's
Okay,
using.
sir.
And here this is alarm mentioning your aneurisys alarm, one of the best strategy you have to talk about. Then desmopressin, okay. And if like say sometime agenda might come, my child is going to some party, or he going to overnight stay somewhere. So mother wants something. Now here desmopressin you have to talk about. Here you are not going to talk about aneurisys alarm or something.
Yeah.
Okay. Yes. Okay, Dr. Ghulam Nabi.
Okay. Thank you. Thank you. Thank you, Dr. Man.
Thank Doctor.
Yes, Dr.
Doctor.
Imran.
Dr. Ghulam Nabi, your patient is a mother of 13 years old, Mrs. Sushma. Sorry, Mrs. Sushma come to discuss her problem of her daughter. Please take proper history and manage the case. This is exam scenario. Okay,
Uh,
start.
Okay. Hello, Mrs. Shushma. I
Yeah,
am Dr. Ghulam Nabi. How may I help you?
doctor, I'm just worried about my daughter.
O-
Whether I don't know whether she will be when she will be married, whether she will be able to have a children or no, doctor.
Okay. I will help out you about this problem. But can you tell me where is your daughter right now?
Doctor, she's in school. Me and husband are really worried about her, doctor.
Hmm. Okay. Can you tell me more about his condition?
Doctor, my daughter Nina, she's been diagnosed with type 1 diabetes last
Okay.
10 days before.
Okay.
Doctor, we are just worried about that one. How she got the diabetes? She's too young to have the diabetes. Plus, doctor told to give this insulin. Doctor, insulin means I have to give my child injection. How I can give injection to my child, doctor?
Okay. We will discuss this thing. Anything else you want to tell me or finish?
Doctor, I'm just worried because we are living in a village
Okay.
system. Like say, we have small town. So,
Mm-hmm.
doctor told to give this injection 3 times a day. I don't know, doctor.
Mm-hmm.
I don't know whether my child will be fine or no, doctor. Maybe she have to live lifelong for this injection, doctor.
Mm-hmm. We will discuss this matter. I want to ask you a few more questions which is related to your daughter health. Is this okay with you?
Sure, doctor.
Okay. Mrs. Shasma, can you tell me how is she performance in the school?
Doctor, she is a bright student so far, and she never missed the school except she used to get sick actually here and after, and we were giving this medications over the counter. She was doing
Okay.
well. One
Okay.
day we
Okay.
took to the doctor, and doctor he checked the sugar. The sugar
Mm-hmm.
was very high. He sent immediately to the hospital, and hospital they did some blood investigation. They said my child having sugar. They said
Mm-hmm.
type 1. I don't know, doctor, what is type 1? They say it's not type 2, it's type 1. I'm
Mm-hmm.
worried
Okay.
about my daughter, doctor.
Okay. Okay. We will sort out this matter. Can you tell? I want to ask you a few more questions, which is related to your daughter. Okay. So, did she ever have before any long-standing illness?
No, doctor, she used to get this flu, cold, cough, this kind of thing used to get only.
Okay. Okay. So, recently, is she too much going for urine, passing for urine?
That is, of course, being a girl, she's having habits since long time.
Okay. So, is she eating more?
No, doctor, she is eating, but not going to her body because her body is lean and thin.
Okay. Is she feel cold? Is other is not?
No, doctor.
Okay. Is she feels too much thirsty? Too much drinking the water?
No, doctor.
Okay. May I know his BMI according to weight and height?
Okay, Dr. Ghulam Nabi, I am holding again. I will start for you again. Okay, Gulam Nabi,
Okay.
this is established case of type 1 diabetes. Mother is concerned about the child injection and reproduction. Okay, rest nothing to worry about it. Okay, so don't go with the history of whatever been already been established. Okay, okay, start
Mm-hmm.
now. Okay, start.
Okay. So I will ask the question which is
Start from beginning. Start from beginning. Okay.
okay. Hello, Mrs. Shishma. I am Dr. Ghulam Nabi. How may I help you?
Doctor, I'm a bit worried about my daughter. My daughter Hina, doctor.
Mm-hmm.
How she's going to take this injection, doctor? Doctor told that she's having diabetes and I have to give her injections.
Mm-hmm. Mm-hmm. Where is your daughter right now?
Doctor, she's in school. Me and my husband really worried about my daughter.
Okay. This is my request. Next time you will bring your child, I will ask a few questions to her also, and I will examine her also, and will let you know the further things. Okay. First thing is
Okay.
this. Second thing, who told you that she have a type 1 diabetes? Okay, you known by the hospital. Okay.
Yes, doctor.
Now you are worried about the injections, you mean to say?
Yes, doctor.
Okay. So, um, uh, so I want to know a few more things. In your family, I mean to say, is because you are a mother, and where is
Yeah.
his father also?
Doctor, her father is in the school that work.
Okay, okay. So she have also his. You have another daughter or son. He have also siblings.
No, doctor. She's
No.
the only daughter,
Okay.
She's the only daughter, doctor.
Okay. In your family, anyone have the same situation?
No, doctor.
Any high blood sugar, high
No,
blood
doctor.
pressure?
No,
Okay.
doctor.
Okay. So, what do you do for living, Miss Shishma? I want to ask you,
Sorry, doctor.
what do you do for living?
Doctor, I am a teacher, school teacher, and my husband is a banker.
Banker and teacher. Okay. And she is your daughter is living with you. Am I right?
Yes, doctor. Yes, doctor.
Okay. Everything is okay at home in your work area. Any
Yes,
stress?
doctor. Everything is all right, doctor.
Okay, okay, okay. So, मुझे समझ में नहीं आ रहा कि इसको हैंडल कैसे करना है. Okay. So, we will क्या करना है?
Go ahead, doctor. Go ahead.
Because आप you are subtracting everything, psychosocial, family, everything. You are just asking for the counseling.
No, you have to go for psychosocial everything, doctor.
I'm
But
asking
you should
because
not.
you stopped me
Yes.
and you told
No, no,
me
no.
that
Because
everything is
you should
finished. You
not
are
ask
not asking.
about. No, no, doctor. You should not ask about his HOPI. HOPI is nothing. Okay. She's worried about her daughter. Okay.
I'm
Let
asking
me
for the
start.
rest, Dr. Imran.
Okay. Just go do whatever you want to do. Just go ahead, doctor. I'm not going to distract. Just start continue.
What to do now? Time is finished. Okay. So,
Okay, I'll start for you. Okay. Mrs. Sushma, good morning. I'm Dr. Iman here. How may I help you? Doctor, I'm worried about my child health. May I know what is your child name? Doctor, she is Kiran. Okay, how old is she? Doctor, she is 12 years old. How may I help you in this regard? Doctor, my doctor told that my daughter will be taking the injections. Okay, may I know what injection, Mrs. Piran? May I know more about it, doctor? She's been diagnosed with a type 1 diabetes. How you came to know that she's become diabetes? Doctor, she was getting frequently sick. Then went to the doctor and doctor to check her sugar and he found out that she's having diabetes, type 1 diabetes. I don't know, doctor, what is type 1 diabetes. Okay, Mrs. Kiran. So Mrs. Sushma, is there anyone else having the family is suffering from diabetes? No, doctor. Okay. Mrs. Kiran, how she's doing in the school? Everything is fine? Yes, doctor. Everything is good. So how's her eating habit? Everything okay? Good. Is there any like say past medical history? I already mentioned. Okay. So you are not going to talk about HOPI because HOPI means she's been already established diagnosis. Okay. So you are not going to ask whether how much she's passing urine, she's feeling thirsty or not, weight or not, whatever. So on, that is nothing. Okay. Now her concern is only concise way. It is exam scenario of May 2025, Karachi. Okay, that mother was talking like this as I'm talking to you, doctor. The same thing it was, same script I'm telling you. Doctor, we are worried she will not be able to have a children in when she will become married. Okay, doctor, I'm really worried about it. So, Mrs. Sushma, don't worry. We are here to help you. Just wanted to know what is your main concern going on, doctor. I think my child is, she will not be living longer. No, no, Mrs. Sushma, it is not like this. To know more about that situation, I need to ask few more questions. Is it okay for you? So you already asked about past medical history. Now you have to ask how was she was a kid and how about the school, everything gone. So what's your idea on that one? Doctor, I don't know. What's your concern, doctor? Will he be able to she able to produce the child or she how she's going to take the injections? That is my concern. So what do you expect from me, doctor? Can you explain me? Okay, how does it impact? Doctor, me and my husband really worried because we are living in a joint family system. If we didn't mention this thing to my our other family members, if they came to know that no one will marry with her, doctor, this was her impact. That it is the impact of her father, the child father and mother. Okay. Now you have to summarize that you are worried about 14 years old child, your daughter, Miss Kiran, about her diabetes, recently diagnosed diabetes, and you think that injection. You're talking. We wanted to discuss about injection and about her, future. Am I right? Is there anything you want to add? Okay. Now 5 minutes are there to talk on this story scenario. In a way, Mrs. Kiran or Mrs. Sushma, first of all, let me tell you, type 1 diabetes. Do you know that what is type 1 diabetes, doctor? I don't know. Type 1 diabetes means like say her body is not making insulin. So for that one, we have to give a insulin in the form of injection. Unfortunately, there is no other way to provide that insulin other than injection. And you're concerned about injection. Let me explain you. Um, Nowadays, it is not an old technique that you have to take the bottle and you have to keep the bottle and big needles are there. It is very small needle. Now it's come as a pen. Okay. And nowadays we have more device also to check your child sugar at any time. So you're getting me. Mrs. Sushma, first of all, let me be clear on that one. We have to work together, being a parent and being a health practitioner. I'm here to help you. First of all, I'm assuring you there is no such harm to take the injections. Are you getting me, Mrs. Sushma? Okay, doctor. And since she's going to take the injection 3 times a day, so one injection she will be taking in the school. Okay. So our first priority to inform the school about her injection timing. Are you getting me? This is a lunchtime. Okay. So they must know about the child sugar status and sugar level. So since again you're worried about that she's going to they are going to prick the child every time for the sugar checking. No, Mrs. Sushma, we have a lot of now new devices available. So we will be attaching to your child arm, okay, and it will be attached and it will be connected to your child mobile phone, and we will be mentioning that school clinic also. It will be in case if your child sugar goes up down, so it will be giving the alarm. So for the safety of your child, it is really important. So your query about the needle, I hope so I cleared it. Is it okay? So doctor, what about injection? Yes, good question. In that injection, we call it pre-filled pen. You know the pen? That this pen is nothing. There is small needle. Once you put over the abdomen and there is a click sound, and after that there is no such thing to open the bottle and fill up the injection, and after that you have to give. No, Mrs. Sushma, it is not like this. So now your query, you are thinking about that your child in when she will become married, once she will be married, so no one will marry with her. let me tell you, many children with type 1 diabetes, they are successful parents. Okay, there are many examples in your surrounding and many examples all across the world. There is no such thing, there is no such belief that if child is getting diabetes, they will not be able to have the children. She can have as much as children she want. Okay, that one you are going to explain the child parent. Okay, now let's talk about her diet. Since she is a type 1 diabetes, you know that many things we have to stop taking, we have to stop. Like say white flour is there, like say sugary item, fizzy drinks are there. So you have to replace all fizzy drinks and sugary items from your fridge with fruits. Are you getting me, Mrs. Sushma? Okay. Second thing, I will suggest you to take full brown, flour rather than getting the white flour. As you mentioned that you guys are taking the white flour. Okay. Plus, you guys have to adopt a healthy lifestyle. So in that regard, I'm giving you this leaflet. Please read on that one. If you have any questions and queries, please come back to me. I'm more happy to help you. And this, I'm sharing my number and my clinic number to you. If anything, any problem, you can go for it. Now we are going to talk about hypoglycemic, episodes. Okay, sometime your child might experience hypoglycemia. So there is some injections we will be teaching you to give or how to deal with your child at home. Plus, your child, you have to keep some sort of sugary drink or something in her bag all the time wherever you travel. And the next thing, Mrs. Sushma, about handling the insulin, pen. So there are small, very beautiful, colorful boxes available to keep the temperature controlled, boxes available. So that will be maintaining the temperature of your child insulin at the school. Are you getting me? And for travel advice, I will be suggesting to keep the insulin along with it. Okay. There is no such harm to keep the insulin out of the fridge. So, in this way, you're going to mention and you're going to talk about child safety netting and red flags, whatever, so on, doctor.
Thank you, Dr. Imran. Very
So,
nicely done.
yeah,
Thank you.
doctor, yeah. So this is a actual case of, actual case of May 2025 exam in Karachi.
Mm.
Yes, and that exact script I'm telling you, doctor, that is a exact script from there.
Mm. Thank you for learning. Thank you very much.
Okay, welcome, my boy. Just
Boy.
important thing, Doctor Gulam Nabi, uh, don't give up actually.
No, I'm not a give up, Dr. Imran, but there is no space to khalas
No,
okay,
no, no,
leave
no.
it. No, no,
I will
leave it.
give you I will give you a lot of time. The important thing, doctor, here, if you don't give up, no, believe me, it will be more
No,
beneficial for you.
no, I'm not giving up. Inshallah, let's see what will be. I'm seeing everything. Okay, thank you.
Thank you,
Dr.
doctor.
Imran?
Yeah.
Yeah, in the real exam, are we supposed to mention the devices' names as well, or just devices for sugar checking, or any further advanced like nowadays they are doing for type 1 pancreas transplantation?
No, doctor, not pancreatic transplantation, but you can talk about this one only because patients worried about the needles, patient
Mm-hmm.
worried about that having the children in the future. That's important, doctor. We are going to talk about patient's eyes impact.
Okay, doctor.
Okay, sometimes we will be getting the cases which we are not expecting that we will be getting. Like say report patients are there, X-rays with you in the patient or ECG with the patient. So these kind of things we might expect. Okay, so that way we will be forgetting our real, history of presenting illness and other things. So definitely it will give you a little bit more shaky moment. What I'm going to ask. Okay, so Dr. Nimra.
Yes, doctor.
Your patient is a mother of 2 years old, Mr. Master Bilal, come to discuss her child problem with you. Take proper history and manage the patient, manage the mother. No examination.
Okay. Hello, good day. My name is Dr. Nimra. I'm your GP today. May I know your name, please?
Doctor, I'm Tania.
Okay, Mrs. Tanya, how are you?
I'm good, doctor, but I'm worried about my child, Bilal.
Mm-hmm. Can you tell me something about him?
Yesterday, Bilal had a high fever and then suddenly started shaking and his eyes rolled up. I thought he was
Mm-hmm.
dying.
Mm-hmm. It's very depressive for you. Can I know something more about about his problem?
Yes, doctor, he has been unwell since the morning and with a high temperature and runny nose. In the evening,
Mm-hmm.
his fever went up, doctor. Suddenly, he went stiff. Then he started
Mm-hmm.
shaking all over, doctor, and his eyes rolled up and he wasn't responding when I was calling him.
Mm-hmm. Okay. Okay. Yes, it's a very difficult situation for you. Can I ask you a few questions about Ali?
Yes, doctor.
Yes, please tell me. How long was the duration of this fit?
Doctor, I think it was 2 to 3 months, but minutes, but
Mhm.
I felt it was much longer for me because it was too much and
Mhm.
horrible scene for me, doctor.
Mhm. Was it the first time he get this fit?
Yes, doctor, this is the first time.
Mhm. Okay. And does he hurt himself? Any tongue biting?
No, doctor.
Okay. Does he leaks the urine at that time?
No, doctor.
Okay. And does he sleep enough after that episode?
Yes, doctor. After that, he went floppy and sleepy.
Okay. Okay. And he wakes up after how much time?
Doctor, after that, he wake up nicely.
Okay. And does he have any other episode throughout the day?
No, doctor.
Okay, that's good. Okay, please tell me how Ali was born.
A normal delivery, doctor.
Okay, any complication at that time?
No, doctor.
Okay, he was full term.
Yes, doctor.
Okay, and does his immunization up to date?
Yes, doctor.
Okay, and do you feel that he is developing normally?
Yes, doctor.
And tell me about his feeding. Is he feeding? Was he breastfed?
He was thoroughly breastfed up till age of 18 months, and after that, I wean off.
Okay, okay. And now you have started weaning and giving him other food also.
Yes, doctor.
Okay, okay. And tell me, Mrs. what is crossing your mind?
Doctor, I went to the emergency hospital. Doctor in A&D said that emergency. They said it is a febrile convulsion, but I don't really
Mm-hmm.
understand what does this mean.
Mm-hmm. Okay, I'm here to tell you. And what is your main worry?
I'm terrified. It will it happen again and again, doctor?
Okay, okay, yes. Okay. And what do you expect from me? How can I help you today?
I want you to tell me that what is this febrile convulsion they mentioned in the emergency
Mm-hmm.
department, and will be
Mm-hmm.
okay, and is it long term? Will it happen again and again?
Mm-hmm. Okay, okay. Okay, and you already told me that you were very terrified at that moment. Any other impact on you?
No, doctor.
Okay. And Mrs. Tanya, sorry, I forgot. What do you do for your living?
Doctor, I am a teacher.
Okay. And what his fathers do?
His father is a shopkeeper.
Okay. Anyone smokes at home?
No, doctor.
Okay, that's good. And any problem at home or work?
No, doctor.
Okay, when you are not at home, who cares for Ali?
Doctor, he's in a daycare with me, and a school daycare.
Okay, that's good. Okay, let me summarize you, Mrs. Tanya. You told me so far that Ali have this febrile convulsion yesterday, and you are worried that it may be serious or it will occur again, and you want me to reassure you and tell me what is it. Is that so, or
Yes.
anything else you want to add in it?
No, no, doctor. That's it, doctor.
Okay, okay, okay. I'm here to help you. Okay, Miss Sarah, Mrs. Tanya, let me explain you the febrile Ali was suffering from febrile convulsion. It is
Okay,
a
doctor.
condition which in which the baby have the fit in when he have high grade fever. Okay, and this is nothing
Okay.
serious. Many children in their early childhood have this condition. Okay, and
Okay, doctor.
it is not that it will occur again and again. Sometimes it occurs again, but it is not like that that he will it will develop into epilepsy. Okay, only two
Okay, doctor.
children out of 100 will develop epilepsy who have febrile convulsions. Okay,
Okay, doctor.
and there is nothing to prevent it. Whenever he had a fever, just give him paracetamol
Mm-hmm.
to bring the fever down, and
Mm-hmm.
keep the loose clothing and sponging with normal water. Okay,
Okay, doctor. Okay, doctor.
and another thing I want to tell you that whenever he get the fit, please keep him in the recovery position, and don't throw water or give him anything through his mouth. Okay,
What is recovery
and be
position,
calm.
doctor?
The child pose is the recovery position, that is keep him in the keep his legs bent towards his abdomen. Okay,
Okay, doctor.
okay, and don't shake him or just remove the hazards aside him, and whenever you think, and if it is not controlled in less than 10 minutes, or he had again fit in the second episode of it occur, then please come back to the emergency. Okay, and if it is not controlled, then we will refer you to the specialist. He might start him on a rectal diazepam. Okay, which you can give at home.
Okay, doctor.
Okay, anything else you want to know about it?
No, no, doctor.
Okay, I'm also giving you a leaflet to know more about this. There is nothing to worry about, and just keep the temperature down when he have the fever. Okay?
Okay, doctor. So, is there any
Oh,
ECGs, the brain EEGs or some brain scans needed, doctor, at this point?
no, nothing is needed at this point. Okay? And if it is not controlled, I already told you, if it is not controlled, if it is occurring repeatedly, then we will send you to the specialist. Okay?
Okay, doctor.
Okay. Thank you.
Nimra, still you have 1 minute and 20 seconds to talk.
Okay. Okay, Mrs. Tanya, can you tell me what is your last period? When was your last period?
Doctor, 6 weeks ago.
Okay. Okay. And how is are you pregnant?
Doctor, I think I am, but I didn't check.
Okay. Okay. And do you feeling any nausea or vomiting?
No, doctor.
Okay. Do you have any other kids in house other than Ali?
No, doctor. He's the only child.
Okay. Okay. You may be stressful with this pregnancy also if it is confirmed.
Yes, doctor.
Okay, so just give him good diet and take care of him. And you can also go for the antenatal checkup. Okay,
Mm-hmm. Mm-hmm.
and if you bring Ali, I will also monitor his growth and make growth chart for him and examine
Mm-hmm.
him. Okay,
Mm-hmm.
whether he is gaining weight according to his height. Okay,
Okay. Okay.
and any vaccination is pending. You can also bring his vaccination card.
Okay, doctor.
Okay, thank you.
Uh, yes, Dr. Nimra, don't sit blank when your time started. Time started and time not yet finished. Okay, so you have to talk on
Okay.
that one. First of all, your history was thorough, but here a recovery position is main task to tell the parents. Okay, this is the main teaching point. Okay, you have to tell that lay
Mm-hmm.
him on his side, don't put anything in his mouth, loosen the tight cloths and around the neck, and time the seizure. It is really panic condition, but you have to use
Mm-hmm.
your phone if in case someone is more that one. You have to call the ambulance, seek emergency help. If like say, if child fits last more than 5 minutes, if this is the first seizure as it was yesterday, and he does not start to wake up or breathe normally after the seizure, and he look very unwell, has difficulty breathing, or see a concerning rash over the body, and if you are very worried that there might be a meningitis, neck stiffness, sensitivity to the light, usually drowsiness, mortal rashes over the body, huh?
Mm-hmm. Oh,
Okay, so Dr. Vasia, are you ready to the case?
Okay, sir.
Okay, Dr. Vasia, your patient, mother of 3 years old child, Miss Tania, Miss Tania, mother of 3 years old child, Miss Tania, come to discuss her child problem with you. Take proper history and manage the mother. Sorry, counsel the mother.
Okay.
Okay, doctor. Okay, start.
Good morning. My name is Dr. Vasya. How can I help you?
Doctor, I'm just worried about about my child. Okay,
Mm-hmm.
Tanya. She had a very high fever since yesterday. Today, she's sleepy and not in herself. I'm really worried about something wrong with her, doctor.
Mm-hmm. May I know your name?
Doctor, I'm Hadia.
Okay, Nadia. Tell me since when Nadia having a fever?
Doctor, it's been yesterday. It's been one day, doctor, now.
Okay, and she was all okay before that?
Yeah, she was fine actually, and still afternoon. Around 3 p.m., doctor, she got this temperature about 39 when I checked. I given her
Mm-hmm.
paracetamol and uh, it bugged her, but today it seems worse. She's more sleepy and not interested in playing or eating.
Okay. Uh, have you documented any temperature?
Doctor, sorry, I'm not getting you.
Have you checked her temperature?
Yes, doctor, her temperature is just now I had checked at home. It was 38.5.
Okay. Along with it, she is having vomiting.
Uh, Doctor, she's sleepy and drowsy all the time. And
She's
yes, doctor, and she's passing very less urine, doctor, today.
okay. Since how much time she's not passing urine?
Doctor, I changed her diapers only two since morning.
Mm-hmm.
Very less urine inside.
Okay. And before that, is she having a running nose or any sore throat?
Doctor, I have noticed that some spots on her legs a couple of hours ago, and she's keep on saying that, "Mama, my head, Mama, my head."
Mm-hmm. Okay. And how was his development? Like, is she is doing well according to her age?
Yes, doctor.
Okay. And is her vaccine is completed?
Yes, doctor.
Okay. Is anybody other individual at your home is sick like this before Tanya?
No, doctor.
Okay. May I know if Tanya has any other medical condition?
No, doctor.
Okay. Have you checked any doctor before coming to me?
No, doctor.
Have you done any investigation?
No, doctor.
Okay. Um, how about his father? Um, is he is coming with you?
No, doctor, he's out of station.
Okay. And where is Tanya right now?
She's sleeping. My mother-in-law, she's taking care of her because she was not sleeping whole day, and I'm unable to bring her because I'm also pregnant, doctor.
Oh, okay, I see. It's a very difficult situations for you right now. I'll try my best to help you out in this.
Okay,
Um,
doctor.
but, uh, but the thing is that right now, whatever you told me, the condition of the Tanya is not good as I assume. Okay, so I need to examine her. So, are you accompanying somebody to my clinic?
Sorry, doctor.
Are you are you coming with somebody in my clinic or are you coming alone?
No, doctor. I'm just leaving to near your next building, doctor.
Okay, that's good. So it is possible for you to bring Tanya here.
Oh, doctor. Now I will bring doctor. But do you think that is something dangerous going on, doctor?
Yes. Just first of all, I just want to see what the possibilities you have to bring Tanya here, because whatever you are saying, it seems like she is having a fever. But first of all, we have to confirm it. But right now, she is not taking anything by her mouth and not passing urine, and she is confused and wants to sleep all the time and having a headache, as you told me. So I think we have to get her admit into the hospital in an emergency. Is it okay with you?
Doctor, what do you think that because I was googling, I googled at the internet that the symptoms look like meningitis to me, doctor.
Yes, it might be. But for the confirmation of this, we have to send her to the hospital under the supervision of the kids specialist. So they will do another investigation. Would you like me to explain all the process?
Yes, doctor. I wanted to know, doctor. I'm a bit concerned about my child, doctor. I'm
Yes.
terrified, doctor.
Um,
Maybe she will
um,
die. Maybe some brain damage will be there if I'm not trying doing
no,
some quickly.
okay. Just relax. I will just explain you. It's not like this. I hope so. It's not that much difficult. It's good that you come to me and concern on time. So this is seems like she is having a fever, which is called meningitis. Okay, so it's a brain fever in a simple words. So that's why I'm suggesting you to go to the hospital. So they will pass an IV lines and do and further investigations. We should start on antibiotics as soon as possible and some hydration. Okay, because as she is not taking anything by her mouth and not passing urine, so it's better to keep her hydrated. We will give her by
Doctor, how to give doctor
the
for doctor? Doctor, she is sleepy. Keep on sleeping.
sorry.
She's very sleepy, drowsy. So, doctor, how to feed my child? Doctor, it's not possible.
No, we are. That's why I'm saying we are not feeding her by mouth. We are give her a drip. Okay, they
Okay,
will
okay,
give her a
doctor.
drip, IV drip, and nothing by mouth. And don't give anything by her mouth. And if it's not possible for you to bring her, as you mentioned, you are pregnant and nobody is available at your home. So we are having a staff and an ambulance service. So they will go with you, okay, and bring the child from there. Is it okay with you?
Okay, doctor. But
Okay.
doctor, I'm pregnant, so do I need anything?
Yes.
What,
As the
doctor?
infection she got. So if there is look if there is a different kind of bugs, okay, if this is a normal viral infection or some kind of bacterial infection which is not spread to another person, so it's fine. But if there is some type of infections which can spread to the other person, especially the pregnant, the other child, and the older present at your home, which is called meningococcal.
Have you heard about it?
No, doctor, this is
So,
first time we're reading.
okay. So, what is the conditions you are just telling about the Tanya? It seems like she might get this one, but let confirm it first. If it's this, then you also need to be vaccinated for it. Okay.
Okay, doctor.
But
So,
I will not confirm it right now. Okay.
mhm.
So, if it's some help is available at your home, that's good. It's her aunt or uncle or anybody. So they will can accompany Tanya to the hospital, okay, and inform his father as well, okay. And if it's not possible, then you can go there, but don't try to be more contact with her right now. Can you do
Okay,
that?
doctor. Okay, doctor.
Okay. And once she recovered, then you can come. We will keep in touch, and then I will tell you all the other precautions what you can take for you and for your coming baby as well. Is it okay with
Okay.
you?
Okay, doctor.
Okay. And I hope whatever I told you, you got all my plan. Is it fine,
Yes,
or you
doctor.
want to add something? Okay.
No,
So
doctor.
I'll just write a letter for the hospital and all the treatment which we will get on the way. I will going to mention on this letter. Okay, so they will not repeat it again or when she reach to the hospital. Is it okay with
Okay,
you?
doctor. Okay, doctor.
Okay. Okay. Meanwhile, you are just having here. I'm just going to talk to my staff, so she will bring a Tanya to the clinic, and we will pass an IV line right now.
Okay. Time up. Dr. Vasya, good approach. But best thing I want, let me tell you, because you didn't say that you're going to give any prophylaxis because this is not a confirmed. Okay, if it is already
Okay.
confirmed, then what you will give, doctor?
Uh, so honestly, I don't know.
Okay, anyone else have to discuss or tell about this one? What you will give if like a pregnant
Benzyl
lady?
penicillin.
Yeah,
Benzyl penicillin.
rifampicin
Ciprofloxacin.
600 milligram
So,
1 day,
rifampicin देंगे.
starting from
Benzathine
birth.
penicillin.
She's pregnant.
Azithromycin,
She's pregnant.
azithromycin,
She's a pregnant.
I think rifampicin.
Ceftriaxone, doctor.
azithromycin,
Ceftriaxone.
Rifampicin. Rifampicin.
azithromycin,
Azithromycin, doctor.
Everything, I think.
Rifampicin we can't give it to pregnant.
No, 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 no. No, avoid just to avoid you because we have to avoid mostly or use cautiously. We can use rifampicin, we can use ciprofloxacin, we can use azithromycin, but we have to go with okay recommended antibiotic in the pregnancy for the pregnant contacts. Avoid rifampicin and ciprofloxacin. So preferred agent is a ceftriaxone 250 mg IM as a single dose, doctor.
Okay, sir.
Okay.
Okay,
For
this is the
prophylaxis
safest.
to mother.
Yes, preferred agent, doctor.
Okay, thank you.
Okay, this was a
Sir,
scenario
what
case,
we
I
will
think.
give kid? Sorry, I missed.
Sorry, doctor. For the pregnant lady, she is in contact with meningitis patient. Okay, confirm meningitis patient.
Sir, can you comment on my case, please? Thank you.
Okay, so in this case, no, if like say she's a pregnant, so we if like say she's confirmed, no, ceftriaxone 250 mg IM as a single dose we can give, highly effective as eradicating nasopharyngeal carriage or something, whatever, so on, and considered safe in the pregnancy, especially recommended as the preferred option in the pregnant contexts. Okay, so this one, the reference I will give you. Okay, CDC Yellow Book. Okay, CDC Yellow Book showing that meningococcal disease post-exposure prophylaxis. Okay, in CDC Yellow Book.
Mhm.
Dr.
Yes,
Imran,
yes, Dr. Asya.
Dr. Imran, if a patient came to us with a meningitis like rashes and high fever, neck stiffness is there, do we immediately send or we will offer first benzyl penicillin injection over center?
No, we will be giving benzyl penicillin is at our level. No, we are giving.
Then only we will refer immediately to
Yes,
admission.
doctor. Yes, immediately. Yes, because this is time saving. No.
Okay, thank you.
Dr.
Dr.
Imran, I have
Imran,
a
we can
question.
also give intramuscular ceftriaxone.
Yeah,
Yes,
this was
doctor.
my question also. We can
Yeah,
also give
doctor.
ceftriaxone.
Yes, doctor. Now, intramuscular ceftriaxone CDC book, as a CDC book says that we have to give 250 mg ceftriaxone in the pregnant ladies. Okay.
Okay.
Now, I just wanted to
Okay.
tell you because this was the case of 2019 exam. In that one, child was confirmed diagnosis, but mother is pregnant. Okay. The agenda was to know about mother was concerned that whether what I will do, doctor. So, who need prophylaxis? Let me tell you because this is a extra scenario I'm giving you. Mostly the close contact will come as an invasive meningitis disease who is a pregnant, any transmitter. Okay, first step to confirm whether it is a true invasive meningococcal disease or not because patient will come with some report. Okay, and prophylaxis should be given as soon as possible, ideally within 24 hours. Okay, of the case identification, benefit is probably minimal beyond about 14 days after the index case onset. Okay. Now, recommended antibiotic in the pregnancy for pregnant contact avoid rifampicin and ciprofloxacin. Okay. Prefer agent again ceftriaxone 200 mg IM as a single dose as per the CDC guidelines, doctor. Rationals are there and agents to avoid or use cautiously. You can use Dr. rifampicin. Okay, standard adult dose 600 mg, orally twice daily for 2 days. Not recommended in the pregnancy because of uncertain fetal effects. Okay, and particularly in first trimester. If like say patient is in first trimester, you cannot use. But this ceftriaxone you can use in any all trimester, doctor.
Mm-hmm. Yes,
Okay,
thank you.
and let's talk about ciprofloxacin, doctor. Standard adult dose is 500 mg orally once as a single dose. We are giving to everyone. Okay, generally avoided in pregnancy because of the concerns of about effects on over or developing cartilage and joints. And now, additionally concerned about in emerging ciprofloxacin resistance in some countries like say South Asia. Okay. And azithromycin again, we can give 500 mg orally as a single dose and has been shown to eradicate carriage. And it is expected as an alternative in areas where documented ciprofloxacin resistance is available, like South Asia. Okay. Um, who need prophylaxis? Applies regardlessly to the of the pregnancy. Okay, give prophylaxis to the close contacts of a confirmed meningococcal case, including household members or anyone who frequently slept or ate in the same dwelling. One. Number two, intimate contact exposed to oral secretions. Okay, brushes, cigarettes, whatever, sharing the drinks, kissing, whatever, so on. And child contact in the same room or group. Healthcare workers with unprotected exposure to respiratory secretions like say intubation during intubation, secretion, suction, mouth to mouth, breathing. Okay, certain air travel contacts, for example, generally those seated directly adjacent to the on the flight over 8 hours or any duration. If there was any significant coughing, vomiting, as per local guidelines, we have to see. Okay. Uh, Contacts of the contacts do not need prophylaxis. Doctor case might arise here. My son friend got meningitis. Okay, he's admitted in a hospital. Doctor given the prophylaxis to my child, but I'm worried about myself, doctor, whether I need or no. You can say no, you don't need any prophylaxis. Okay. Now, patient might ask you about a vaccination. Pregnancy itself is not a contraindication to men ACWY vaccination if indicated because of the risk of our local public health recommendation. You have to follow again. Men be generally deferred in the pregnancy. Okay, unless very high risk and benefits judged to outweigh the theoretical risk. Vaccination does not replace the need of chemoprophylaxis in close contact, doctor. Now, patients say, doctor, I want vaccination. So we can say, Mrs. Tanya, vaccination cannot replace that your chemoprophylaxis, though it is, you think that it is not it is what you call it. You're thinking this is dangerous, but let me tell you, we have other option which might we can go for it. Okay. So for a pregnant lady, you can say that for the pregnant close contact of invasive meningococcal disease, we will be giving ceftriaxone 250 mg IM once as a first line post-exposure prophylaxis and avoid rifampicin and ciprofloxacin. Doctors, you should always follow your local public health guidelines. Okay, not what we are talking about. This I'm talking in a general. You are getting me, doctors? So,
Yes, Dr. Imran. Dr.
yes,
Imran, can you
yes.
please repeat the last scenario in which the kid is in the hospital and he got prophylaxis? What about the mother?
Can you repeat, doctor?
Yeah, the one in that the kid is in the hospital. He got prophylaxis of which one?
No,
And
no,
the
no.
mother will not get the prophylaxis.
No, no, no. For example, A child has been diagnosed with meningitis, and B child was a close contact with that patient. Okay. Now the team, infectious control team, they given the prophylaxis to that child. Now mother is worried because she's thinking that she is a pregnant. Okay. She will also get this meningitis, but she is not close contact to the person who was diagnosed. Okay. Now her son is close contact. Okay. It now contacts of the contacts cannot be treated with the prophylaxis.
Okay, now clear.
Got it. Yeah.
Yeah.
Excuse me, sir.
Yes, doctor.
Sir, what about vaccine? You told that we have to give prophylaxis and not to give vaccine. Pregnant lady will
Doctor,
not get the vaccine. She will
no,
just
no, no,
take the
no.
prophylaxis.
First of
But
all,
other,
that agenda,
yeah.
no, no, doctor, I was talking about sometime scenario may arise that patient will say, doctor, I want vaccination. Okay, now you know that she need a chemoprophylaxis, not a vaccination. Vaccination cannot replace the need of chemoprophylaxis, no, because she think that maybe antibiotic is dangerous for the pregnancy. Now you got it?
Yes. Thank you.
Okay, doctor. See you tomorrow afternoon, and tomorrow will be also one session from my side. There will be no two sessions because again, schedule is my schedule is a bit tight. So I'll be sharing that one, and we will be going according to that schedule. Okay. And there was one question being asked by Dr. Vasia about what happened in a diabetic case if become blank during the consultation. So how we can cope up? Yes, doctor. Blank means you should not stop talking. You should talk.
Okay. Sir, can you please comment on my today's case because that's the first time I'm presenting. Can you please tell me how was it and where I have to?
Doctor, first of all, this patient mother was concerned about that her child got this things. Okay, so you have to ask about red flags like say vomiting. You ask that about the headache. Patient already mentioned that she's having her child is complaining of headache and neck pain, neck stiffness, kind of stuff. Fever is high and rashes are there. So we have to suspect that is a meningococcal meningitis is there. And she went to the emergency, and emergency people told that this is for example, they told that this is a kind of, we have to send this patient to the emergency. But in case she went to the emergency, now she come to you, that a different scenario, then you can talk about in a way that they already mentioned that the meningococcal meningitis, now you need a prophylaxis. But in your case, you didn't miss anything except the eyes. Eyes was missing,
Yeah.
impact was missing, doctor.
Yes. Okay,
Okay,
sir.
summary was summary. You did summary, I know, because I didn't put a tick mark on
Yes,
that
I
summary.
need to get up there. Yes, sir, I did a summary.
Okay, that's great.
Yes. Okay, sir,
So
thank you.
see you guys, inshallah. Uh, tomorrow, and I'll be mentioning the time, inshallah. Okay. Thank you very much.
Thank
And
you,
don't worry,
Dr.
Doctor.
Imran. Thank you to
Dr. Ghulam
teaching
Nabi.
us.
Thank you, sir.
Thank you very much.
Thank-
Thank you.
thank-
Thank you very
thank-
much. I am your boy. Thank you.
Okay. Thank you very much. Thank you. Bye.